Hello friends, let's talk about chronic kidney disease. I've been conducting awareness programs for chronic kidney disease since last 10 years, and I'm glad that many of the practitioners are getting aware about this, and still the message needs to be spread. That's the reason we have created this video. How we define CKD? CKD is a chronic kidney disease. So mathematically it's defined as a reduction in the GFR less than 60 ml per minute over a period of more than 3 months, or any pathological abnormality in the kidney like hematuria, proteinuria, or structural abnormality on imaging like polycystic disease or small kidneys which are visualized on imaging, which are lasting more than 3 months. These all criteria fit into the definition of the chronic kidney disease. So the common causes of chronic kidney disease. The common causes of CKD are mostly our chronic diseases like hypertension and diabetes, which account for the bulk of the CKD patients. There are also other causes of CKD like glomerulonephritis, chronic pyelonephritis, chronic infections, drug-induced kidney diseases, and the list is n number of causes in that. But the common causes mostly are the hypertension, diabetes, and glomerulonephritis. To identify the CKD early, either we have to rely on the investigations or screening procedures or on the symptoms. As we know, the kidneys are very tolerant organs. The symptoms are not manifested very early. So to diagnose CKD early, we need to screen the patients. So whom should we screen? We should screen the patients who are having risk factors like hypertension, diabetes, or who are on chronic nephrotoxic medications, or who are getting recurrent urinary infections, or patients who are on glomerulonephritis, or patients having family history of CKD. These patients, even if they are not having any symptoms, they should be screened for CKD. As we know, the symptoms appear very late in the kidney disease. The patient to develop the symptoms, at least 80% of the kidney has to be damaged before the symptoms develop. So most of the patients which present to us, they present with symptoms. Means they are already the disease has progressed to a stage that the recovery or reversibility is nearly not very much possible. So waiting for the patients to develop the symptoms usually lands the patient to the advanced stages of the CKD. So screening the patients early is a key. Even in the screening, what we usually check is the urea and creatinine. These parameters are highly insensitive parameters. So even if the patient's kidney function is lost 30 to 40%, the creatinine may not rise in these patients. So even the screening procedures are also not very sensitive. So at-risk patients should be regularly screened because the parameters or the modalities which we are using are not very sensitive. So the question of whether all CKD patients progress to ESRD, yes, the answer is not very clear cut. Not all CKD patients progress to ESRD. Some patients are progressors, some patients are non-progressors. So identifying which patient is going to progress to a CKD is quite important. There is no specific criteria as to know that which patient is going to land into chronic kidney disease or not. So it is overall a clinical judgment, the experience, and the trends of the RFTs and the basic underlying disease or pathology which decides the progression towards the ESRD. So these things, whenever you detect a CKD, not only diagnosing a CKD, but we have to predict whether he is going to progress towards ESRD or not, has a major prognostic indications. So how do we retard or prevent the progression of CKD? So whenever a CKD is diagnosed, the main thing which decides the prognosis of the disease is the cause of the CKD. So we need to know what exactly is the cause of the chronic kidney disease. Whether it is hypertension, diabetes, some glomerular disease, or some drug-induced, or some infections, we need to know that, because treating the underlying factor disease, it prevents the progression of the CKD or prevents the patient towards landing into the ESRD. Also, the other measures like diet, lifestyle changes, blood pressure, sugar control are also quite important. There are also new specific medications being available which can prevent the progression towards landing into an ESRD like RAS blockage, and there are new modalities of new diabetic medications, new heart failure medications. These are also quite important which can be used to retard the progression of the CKD. So the last question, whether CKD is a neglected disease? Yes, CKD is a neglected disease. The neglect occurs because the signs and symptoms of CKD are far late to appear. So a patient who is having a creatinine of a raised creatinine but no signs and symptom may feel that he is not having any symptoms, so probably there is some misdiagnosis, so he may not seek, or there are n number of irregularities in the treatment, or the compliance of the treatment is also affected in such patients. So CKD in general is a neglected disease because the signs and symptoms are far late to appear. For CKD to diagnose, we have to proactively test the patients who are having an early or risk factors. We have to proactively test them and keep them monitored regular basis, maybe 3 monthly, 6 monthly. We need to check them. And also, as we know, we are having 2 kidneys. So mostly we don't require 2 kidneys. Whenever a patient, someone in the family requires a kidney, we donate the kidney to him. So with only single 1 kidney, we can sustain our life. We don't develop and usually don't develop an CKD in this case. But that clearly indicates that how much reserve we have in a kidney disease. So whenever a patient develops early signs or small rise of creatinine, it is far important to diagnose that. Not only to diagnose it, we also need to check whether this patient is going to progress towards an ESRD and may require dialysis or transplant later on. We need to assess whether it is a progressive, and also it is important, not only important to try to reverse the disease, but also preventing the progression of the disease or retarding the progression of the disease is also quite important. So as far as any other disease, what we say is prevention is better than cure. But as far as CKD is concerned, it is always said that prevention is much better than cure.